Hello, everybody. Hello again to all of you who participated in the events yesterday and on Friday. My name is Niklas Oppenrieder. I am the Medical Director of the Physicians Association for Nutrition, Pan International, and I would like to welcome you very warmly on behalf of the whole VegMed Consortium, the Charité University Outpatient Clinic for Integrative Medicine at the Emanuel Hospital in Berlin, ProVeg International, the Reformhaus-Fachakademie, and PAN itself. So we already had two exciting events. We discussed the impact of food on chronic disease with Dr. Walter Willett on Friday. We had a very lively interview with Dr. Greger and Jens Tudor yesterday on the topic of pandemics and their connection with food and food systems. And we're about to attend another exciting panel discussion. VegMed and PAN will provide you with more online events throughout the whole year 2020. But this is, of course, not really comparable, at least in my humble opinion, with the real thing, with VegMed conference in Berlin, with its 3 days packed of science, practical learnings, some of the most renowned speakers in the field, and maybe more importantly, even healthy, delicious food, great new relationships, great new networks, and springtime in beautiful Berlin, in and around the beautiful Henry Ford building. So we got a new date. So this all is possible again next year, 2021. February 28th till March 2nd will be the next VegMed conference. And some of you may have noticed that this time the conference will be on Sunday, Monday, and Tuesday. So this might give you 2 more days in the plant-based capital in Berlin. So we would be happy to see all of you at Europe's largest conference, on Europe's largest medical conference on plant-based nutrition next year. So for today, make sure to use the Q&A. If you have any questions for the speakers, please write them in the Q&A box. We will select some questions, and today we will definitely have some time to get to a few of these questions. Yeah, so feel free to use this Q&A box. Sorry. All right. So as I said, we had NCDs, we had pandemics in the last 2 days. And today we're going to do a deep dive into the topic of climate change, health, and food with a great panel discussion. Your host today will be Dörthe Eickelberg, author, director, and TV host at ARTE and Xenius, among others, who deals with, due to her work, a lot of topics of sustainability, and will be a great host. So I hand over the mic to Dörthe. Thank you very much.
Hello, I hope everybody can see me now. Thank you very much, Niklas, for this world-class introduction. And thank you to ProVeg and the whole consortium to set up this event so that today we can get a taste of what we can expect at VegMed next year. And I'd like to introduce our speakers or say hello to them as well. They will appear on the screen later on. Dr. Springmann, Dr. Martin Herrmann, and Dr. Christian Kessler. So the questions that you can type into the chat room will be collected by our second facilitator, Julia Schneider, and we can sprinkle them in towards the end of our discussion. This webinar is being recorded. I hope you're okay with that. It will be recorded so that it is available on social media later on. So now I would like to see if Marco Springmann is already there. Ha! There you are. And you're sitting.
Yes.
because I don't know who of you guys have followed last night's webinar. I found this quite amusing to see the speaker, Michael Greger, on the treadmill. So that's a quite efficient way to make use of your time if you're very busy at these times right now. Have you considered this as well, Marco?
Yeah, that's a good idea. I actually have my exercise plank sitting over there. So usually when I walk around, I do a couple of things.
Yeah, it was also.
You got to stay fit for sure.
Yeah, yeah. I was also considering of I don't know, combining my daily practice of yoga with hosting webinars, but I'm not sure if you guys want to see this. So yeah, we better stay seated and leave it to the experts. So Marco, you are a senior researcher on environmental sustainability and public health at the Oxford University. And you would like to tell us a little bit about the impact of our diet on the current climate crisis. So what can you tell us about that, first of all?
Well, the way we eat has really a major impact on climate change. According to the latest estimates by the Intergovernmental Panel on Climate Change, the food system is responsible for up to a third of all greenhouse gas emissions. So it's really a major driver of climate change.
So let me just hang on here, because I assume that most of the people who follow this webinar right now are aware of this issue, but let's just quickly sum up what you mean with the responsibility of the third of that impact. That's quite a lot. Like, how does that happen?
Yeah, that is really a lot. So if you think where those occur, then there are three principal components to that impact. So one of the very big impacts is fertilizer use. So when we grow any food, we usually fertilize it. And whilst fertilizing foods, a very potent greenhouse gas called nitrous oxide is created. And that basically warms the atmosphere. Then the second component is a direct component that is primarily associated with ruminant animals. So when, for example, cows or sheep eat grass that potentially before has been fertilized, or they eat some grain mix that has been fertilized, that already has a climate change component. But whilst they digest it in their multiple stomachs, another potent greenhouse gas called methane is produced. So that's the second component. And then a third component is carbon dioxide that we hear about all the time. And obviously on a farm, you have use of machinery, you have the whole industrial processes that produce, for example, fertilizers, but you also have land use changes. And specifically for, again, animal source foods, those make a big contribution, because what you heard maybe from the Amazon recently with all those wildfires, I mean, a couple of those, or some proportion of those, were indeed caused by farmers who wanted to make way both for pastures to have animals on, or for soybean plantations. And those are usually GM soy plantations that are there. So they go exclusively to animal feed, and they feed our pigs, chicken, and a little bit cows as well. So those are the three components that are responsible for the climate change impact of the food system.
But these three components are mainly caused by the mass production of meat, right? By factory farming.
Well, yes and no. So if you think about the methane emissions, we have some good comparisons between grass-fed and grain-fed animals. And it turns out that actually grass-fed cows produce more methane per product. Now the reason for that is that usually grass-fed cows live a bit longer, so they have more time to basically produce those emissions, whilst not putting on more weight, for example. So there are a couple of reasons why that is, but you can't necessarily say that that there is a great difference between mass-produced and not mass-produced. It's only that mass-produced emits more at the moment because there is just more of that, right? But for example, we made a model analysis where we looked, what is if you max out what you can produce on pastures, right? So you just say, okay, we don't put more on pastures, we just leave what there is to not put more pressure. But what there is, we try to max out. So we convert every cow herd into a combined beef and dairy herd, for example. Then it turns out that meat production would be very low, but milk production could be fairly high. And if you, again, use what we know about the emissions associated with those products, and indeed also very often the grass is also fertilized. It's not like that grows for free necessarily. So if you use the footprints that are there, then that might also tip us over what would be regarded as a safe limit to stay within the 2-degree target, for example, let alone the 1.5-degree target.
Wow. So what should the result be then? Should we all turn vegan now? That sounds like quite a mission. To turn everybody vegan.
Sure it is. I mean, according to our analysis, obviously a completely plant-based diet would be the lowest in greenhouse gas emissions. So that is, and it's not only according to our analysis, literally every analysis that is out there comes to that conclusion. Whilst it could also be one of the healthiest if you do it carefully. But we found that you don't necessarily have to go completely vegan. So if you go to a flexitarian diet that only includes animal products on occasion, and with the on occasion, I really mean on occasion, like for example, not having more than 1 serving of red meat per week, and red meat includes beef, pork, and lamb, having not more than 2 servings of poultry per week, having not more than 2 servings of fish per week, and if you have milk, not having more than 1 serving of milk per day. And that includes, that is in milk equivalent. So it's not milk and cheese, it's milk or cheese, for example. So if you stick to those broad guidelines, roughly, then globally we found that we could indeed stay on that 2-degree trajectory where where the food system wouldn't contribute more than it's supposed to contribute to that target.
Okay. Are there measurements, apart from the measures in the area of nutrition, that are highlighted a little bit too much maybe in this whole discussions? Maybe the importance of certain aspects that are maybe exaggerated?
Yeah, there are a couple of things that come up over and over. So one of the things that comes up is transport. So people always think, oh, you should really eat local and transport is very bad. But if you look globally again, then you see that transport of food products is responsible for less than 5% of the overall food-related climate change impact. So it's really small. And the reason for that is that most of the time, literally, if food companies can, they ship everything. And you can load an awful lot of stuff on a boat. So hardly anything is flown. So chances are whatever you consume, if it's not like the most exotic fruit, then it would have been transported by boat. And that doesn't contribute hardly anything. So just for a comparison, if you compare, let's say, a high emitting 1 kilogram of beef, right, which is amongst the highest emitting food products, then you have roughly a factor difference of 10 to other animal products like pork or poultry. And then again, you have a difference of a factor of 10 to plant-based protein sources like beans, lentils. So that means you have a really, really big difference that can't really be bridged by those small differences that transport would make, right? So for example, even if, let's say, you buy lentils that were produced in Canada, right? That would not affect that emissions impact of those lentils by a factor of anything, right? It might be like 10% or so, but it wouldn't go to basically 1,000% that you would need to go even to an animal source food. Then the second thing that is always highlighted is plastic, maybe, right? Lots of people are concerned about plastic packaging, and probably not so much because of climate change, but because plastic might end up in oceans. But also there in high income countries, there is really not much indication that the plastic that is thrown away there ends up in the oceans. That is mostly single-use plastic in lots of Asian countries. So what we throw away is either burnt or ends up in landfill. And you might criticize that, sure, but it's definitely not a big of a contributor to the climate crisis as the types of food we eat.
It's interesting, though, that in that whole discussion about the climate change, it's always the carbon emissions of transportation, of travels mainly, that is being mentioned as the main indicator. And most of the people don't actually know about the impact of our whole, let's say, animal product industry. So what do you think, why is that? Like, why don't we know about this?
Yeah, that's up to anybody's guess, I suppose. I mean, not long time ago, the primary focus in this whole discussion about climate change was really on the production side. If you look at the production side, food or diets is a consumption thing, right? It doesn't really pop up when you look at the consumption side. What you see there is energy use. You see all those coal-fired power plants, for example, popping up, and you see the transport sector. You see maybe agriculture, but in the official statistics, the impacts of agriculture are assessed in quite a funky way. So anything that has to do with machinery use in agriculture doesn't pop up in agriculture, it pops up in that machinery and transport, in electricity generation. So only if you go to a consumption accounting, then you suddenly see what big impact the food system has. So I think those are really structural drivers that prevented us from looking at it in a more holistic way.
Mm-hmm. So you've mentioned already what some nutritional recommendations to us as consumers. So what can health professionals do to influence or to implement these recommendations of yours?
Well, I think very often health professionals are sort of trusted mediators in some sense, right? I mean, I suppose it's not very often that health professionals choose to highlight very much the impacts of diets on health, although we know in terms of prevention, it can really have a major impact. According to the global burden of disease, dietary ill health, related to dietary risk factors like not eating enough fruits and vegetables or eating too much red and processed meat, is responsible for up to a third of all deaths globally and in most regions. So if health professionals would highlight a little bit more what a healthier diet would look like, I think that could really go quite a big way towards both preventing disease cases before they occur and to get people to adopt a more sustainable diet. Of course, it's a bit complicated when people come to go to doctors. They usually have already an issue, right? But if at least health professionals have some information at hand that they could direct their patients towards, then that could make a difference, maybe.
Okay. Thank you very much, Marco Springmann. I can already tell that more and more questions are popping up directed to you. So we'll get back to that towards the end of our discussion. And now I'd like to hand over to our second speaker, to Martin Herrmann, Dr. Martin Herrmann, to be precise, who is the chairman of KLUG, Deutsche Allianz Klimawandel und Gesundheit e.V., or in English, the German Alliance on Climate Change and Health, and also Health for Future. And Martin is a medical doctor specialized on transformational change, and he has worked as a consultant for Gavi, the Global Vaccine Alliance, and for the World Health Organization. So, Martin, now with you, I guess we'll talk about the big picture as well, given your scientific background. And you like to talk about the planetary health emergency and to stress the fact that that whole crisis we are going that's going on right now is just one of many crises. So why is it so important to talk about that health emergency now?
I mean, until last year, people were very shy, also in the climate movement, to talk about that we have a crisis. But even the World Economic Forum was talking about that we are sleepwalking into catastrophe because of the risks we are encountering by crossing the planetary boundaries. And it is clear by now that climate change and biodiversity loss represent the biggest risks for our civilization. The risk to irreversibly alter the natural systems and creating suffering for all beings beyond imagination. I think what we are learning now in a crisis is that a pandemic, when you hear about it first, it doesn't sound so bad. When you're in it and you see the second and third order implications of a global shutdown, you have a very different understanding of what this is about. And I think it's important when we now look at the climate and biodiversity crisis that what we are talking about, I mean, Marco was talking about the 2 degree we are trying to stay below as part of the Paris Agreement. Now we are on a trajectory to go 3, 4, 5, 6 degree up. And this is clearly a catastrophe. And it's very important to be aware that we are on no way on a trajectory that is limiting the risk. We are still continuing to adding risk to where we are. And the second point, I think, why do I talk about a health crisis, a planetary health emergency? I think it's important to understand when we are in the process of destroying the platform on which we live, when we destroy kind of what we depend on and future generations depend on, this is not very healthy. And even today, across the planet, we see that hunger and malnutrition is going up. Natural disasters are getting much more frequent. You just need to get back to the pictures of Australia or the Amazon or Siberia, all the fires and the storms we had in the last 12 months. Heat is leading to tens of thousands of premature deaths each year and 100,000 and millions of people suffering severely. Pandemics are getting more frequent. Pollen allergies are occurring all year round. Infectious diseases like Zika, malaria, tick bites, dengue, and others are on the rise. And this is not a complete list. So this is not happening kind of in 5 years or 10 years. This is happening now. And the consequences are also connected to migration, violence, and war. And they overburden already weak health system, especially in the global south. The most vulnerable are also the most affected. And also here in Germany, hundreds of thousands of people are already suffering of the consequences. So it's not something that is only happening to the polar bears. Once you understand the symptoms and you talk to friends, you talk to neighbors, you look into your family, you see that your grandmother might be affected, that your child might be affected, that yourself might be affected already. And it's very important to really see that it's happening here. It's not happening somewhere else. Because when you diagnose an emergency, it is a clear call for very strong and direct action.
So you actually want us to treat all these crises that you have mentioned as an urgency. And well, quite obviously, we're going through a crisis right now, since you mentioned the pandemic before. So I have to mention the C word, and now I don't talk about climate, I talk about Corona. Do you think that the current Corona crisis is also kind of a result of all what happened before?
I mean, you probably have seen that there are many scientists pointing to that the connections to the of pandemics to the way we are treating nature. That natural resources are getting smaller and smaller. We are kind of destroying soil. We are leaving less kind of places for nature and wild animals. And it is clear that through that the pandemic risk is rising. Now, with regard to the corona crisis, how much of this is the case or not, it's not me to judge. But it is also clear in this crisis that we are seeing the weakness of many health systems, and we are seeing the weaknesses that we're exposed to because of the global supply chains we have and the dependencies we have on each other. And I think that's a very important thing to take into account. It's also getting clear that when you have a health crisis, there's a risk, or you have to stop many other things, because without health, all the other things are not really valid. And I think what there is also learning about, that if you take a crisis serious, that we can do that, that we are willing to do that. And I think that's something we need to take from that for how we treat the climate crisis, because with a medical narrative, I would say the pandemic now is more like an emergency that perhaps will last for 2 or 3 years. But then when you treat an emergency as a doctor, you also need to look at the other symptoms of the planet in this case, and see how you address the longer term issues also in your short term answers. And it is very clear that the longer term risks are even more heavy than what we are confronting right now.
Okay, so can you give us an idea what health professionals can do about this now?
I think it's important to be aware that until very recently, climate change, especially in Germany, wasn't an issue in the health sector. Until 1 year ago, there were very few people really focusing on it. This is slowly starting to change. But it's very important that it changes fast, because I would say the moment we as health professionals stand up and make it a clear case, this will be heard, because we are a very powerful professions. We are, from all the professions, we have the highest reputation. And also when we talk about health, it reaches people much more directly than any other case. And I also want to point to that so far in the climate movement and the climate NGOs, they have mostly focused on energy, on the science, on transport, on travel, but they haven't very much focused on health. And I think that's a big mistake, because with health, you reach people. So I'm very positive that if we as the health professionals takes the diagnosis that is clear, serious, and speak it clearly, it can be a game changer. That's why I really invite everyone who is a health professional, and also the other people who are concerned, to really look into the health argument and spread the word and be very explicit and outspoken when we are in public.
I think one of the challenges about raising awareness for the current climate crisis is that the overall effects of it are long-term. So they're more abstract. And but are there some short-term effects, talking about health issues, that you can bring up to warn people so that they can take this topic more seriously?
For example, heat you can bring up. Every year when we have heat waves, 5,000 people and more are dying prematurely, and hundreds of thousands of people are suffering here in Germany. Yeah, you can use allergies. So there are many, many examples of things that are already happening here. And there's one other very important point. When we take climate protection serious, we have tremendous health benefits. So when we eat differently, when we use a planetary health diet, it's much more healthy for us, and it's the best way to fight against the non-communicable disease pandemics that we have worldwide. If we are more actively mobile, if we walk and cycle, it's very good for our health. if we take things a bit more easy and have being enough, so that you don't need always more and more and more, it's actually leading to a less stressful life. It will lead to better relations and so on and so forth. So it's very important that when we go the path that is recommended for climate protection, we have nothing to lose. It's not a sacrifice. It's actually the path to a good life. And that's a message that we as health professionals can spread. So it's not about a miserable life. It's about celebrating life, but also recognizing what a wonderful gift we have to be here alive on this planet, this unique jewel in the universe.
And now, before we gather up the questions that are piling up for you as well towards the end of this talk, can you quickly talk to us about a little bit about Klug, what your aim and your mission is of this initiative? So maybe to give some idea to the health professionals out there, how they can actually maybe get inspired by this.
I mean, basically it was coming, we were founding Klug because we saw the topic is not an issue in the German health sector. And we want to make it a priority. And we want to make sure that we as health professionals are taking the lead in climate action. And we will also want to spread the word that when we change the affairs, we don't need a majority. We need 3 to 4% of the players to be change agents, to not just observing or reading or knowing, but to get active, to get on the playground, to change your own behavior, but also to be active strategically on a political level, like some of our ancestors, like guys like Virchow or Pettenkofer, when they did change the political system in the 19th century, they were our predecessors. And I think we can come back to this kind of spirit to be out there. And when we, for example, have made actions in public, in front of the Siemens shareholder value meeting, with our white coats and with the planet on a wheelchair, people would come to us and photograph us. We were in Tagesschau and other places because it's a very strong picture. So if we stand up with our reputation, we can be a game changer. And I think it's really important that many, many people join Health for Future and join Klug. And as one of the things that we are doing out of this commitment is in 10 days, there will be the first German planetary health lecture series starting. So you can, I think Nick will mention this later, how you can go there, which will give you all the information you need to be a change agent, because that's the invitation, that we are not just knowing about it, but that we are changing our way of looking at it, being a driver for the change that is needed.
Okay, thank you very much, Martin Herrmann. So talking about getting active, so I'd like to hand over to the third speaker, who is the co-founder of VegMed and the research coordinator at the Charité Clinic for Integrative Medicine at Emanuel Hospital, Dr. Christian Kessler. Hello.
Hi.
So Christian, you work with patients every day. So tell us a little bit what you do to make a change here.
Yeah, so being a clinician and being a clinical researcher, we often have to go down pragmatic ways, because by theory only and by dogmatism and extremism, reality teaches us, this tough lesson that it hardly ever works to win over people for your agenda. So often it's a stepwise process, and I always tell patients, every step into the right direction is a good step. So sometimes you have to start slowly. Other patients are more receptive, more open, and oftentimes also depends on the condition that they're in. We experience that people with tough health conditions are often very grateful for nutritional interventions, such as an introduction into flexitarianism or plant-based nutrition, or fasting interventions, etc., etc. So, but it all boils down, or at least most of the time, to own experiences with patients. This is the lesson from my past about 15 years of being a medical doctor, it's all about experiencing change, facilitated through the interventions that you agree to as per your lifestyle and as per nutrition. So if people have a good reason for change, and if doctors and other health professionals explain well and are empathetic in the way they explain what the patients could do, should do, then the patients are much more likely to follow such suggestions, and in the end they benefit from it. They lose a lot of their disease burden. They see a reduction of symptoms, a betterment of their cause of disease. They can reduce the dosages of particular drugs. They lose weight. Their diabetes and their blood fat values and several other lab values, get better over the coming weeks and months. So this is all about experiencing the change that you are part of as a patient, and it requires a large degree of empathy and of mindfulness on the side of the physician and on the side of the medical professionals. And it's all about experience. It's less about pure theory and numbers and figures when we're talking about the bedside scenario, or the ambulance setting, or the clinic setting.
Okay, so I think that's a good idea to talk about diets with your patients. That's true. It's something that lots of physicians don't do. What else can be done from your point of view, maybe in terms of addressing the CEOs of hospitals or medical students or chief physicians?
Mm. I was actually very touched by what Martin just said previously in terms of the need for reductionism. At least this is what I understood from something that he said earlier, and that's obviously a very necessary point. Taking the lesson from the climate crisis, but also from the corona fallout and several other global crises. We see that this narrative of eternal growth economy is something that's fundamentally wrong for the planet. Yeah, and you don't have to be a socialist or a communist or a tree hugger, or whatever, to understand this. And this is really surfacing right now, and in all these crises, habitat destruction. I don't have to repeat it; it has all been said earlier by Martin and Marco. The wildfires globally, everything that goes on in the context of the climate crisis. We need to not only change our habits, not only change our nutrition, get more active in terms of physical activity or fly less. We have to reduce almost everything in terms, if we want to save this planet. And I find it difficult even, to handle with, new terminology like green growth or sustainable growth. Looking at least in Germany, important figures like Nico Pech, we also have to get away from this within the sustainability community and also within the plant-based community, that we can stay in our comfort zone, whether we're doctors or researchers or patients or whoever, we can just change our diet from red to green, but continue to be part of the eternal growth story. Permanent growth in medicine, we almost only see in oncology, and everywhere else in nature. Of course, we see a lot of growth, but we also see a lot of non-growth in nature, and of cycles of growth and non-growth, and of recovery. But our economic problem, coming back to your question and coming back to the question of CEOs of hospitals, is that also in the medical arena, in the healthcare sector, we are seeing a scenario where healthcare has become a business like almost every other business. And the rationales that drive healthcare in most countries on this planet by now are pure business rationales. You know, this is probably a slight exaggeration, but we all see it working in the healthcare sectors. We're most of the time in leading positions, you're talking about numbers, you're talking about margins, revenues, like as if you were on a stock market, you know, and big hospital change, hospital groups are owned by big companies or by funds, etc. So this is a fundamental problem, and the CEOs have to follow this law. So sometimes it's quite difficult to get through with very necessary messages of, you know, changing people's diet, not only for medical reasons, but also for planetary health reasons, you know, for planetary health reasons, and you know, this planetary emergency, but also for sustainability reasons, for climate reasons. So also with CEOs, you know, we have to use all these, not only this, but all these emergencies, like the climate crisis, like the corona pandemic, to wake up these people. And we're seeing this everywhere. And I feel that this is actually, corona, for example, is not only bad in the sense that this is also a big opportunity to reboot some of the fundamental problems that have come into existence over the last decades and centuries, and this is a good chance to think over some of our basic sort of almost axiomatic narratives, beliefs, you know, in terms of eternal growth, and in German we say Wegwerfgesellschaft, you know, just throw it away, buy something. If you don't like it, throw it away, buy something new. And you know, if you're a green follower of this idea, you know, you just buy something green, and if you don't like it, you know, you throw it away and buy something green new. Yeah, but this also doesn't work, and this has to be explained to everybody, not only to physicians and patients, but also to CEOs and to stakeholders everywhere, because this is an excellent chance for change management and a clarion call for action that we're deep in the red zone of almost everything on a planetary scale. And if we want to heal the planet, we have to go into a reduction mode everywhere and not change from here to there only.
Wow, Christian, thank you so much. That was actually the perfect bridge to all these questions coming in from our viewers. I think you couldn't hear me, but you could, and you couldn't see me nodding my head. So let me actually address the first question to the whole panel. So Marco, you can also switch on your video and your audio again. So the first question by the way, thank you to everybody for your questions. The first one is, do the speakers think that the necessary changes in health and climate can take place in the current political system? Do we need a system change?
Yes, we do need a systems change because we need a radical change, but what this will look like, no one really knows. Because I think it's very important, we will have to have the courage to act into the unknown. And we can see it now in the crisis that we have a lot of uncertainty. And when we start with climate action, there will not be this one big plan from system A to system B, but there will be a starting point where we start to act on certain things that are quite obvious. And then there will be a crisis popping up that no one was expecting, and we have to rearrange, and we will learn things and we have to rearrange. And I also don't think that there will be one system across the planet. But many of the things kind of Marco was talking about, or Christian was talking about, will be elements of what we are moving towards, which is that growth cannot be the imperative. It is an option in certain phases, but it's not kind of an axiom that you always need to follow. It can't be an ideology. Or that it is more like a freedom to use a planetary health diet because it is a very obvious thing to do once you understand your planetary responsibility. This will have different tastes in all places and all different speeds. But yes, we need a system change because what we are having as a system is killing us. So that's not a good way to stay with it. I just want to add one thing to Christian, because this might lead to misunderstandings. I don't think we need everybody. We should communicate trying to reach many, but it's really important. You need a critical minority to turn things around. You don't need the majority. But turning things around means the minority goes on the playground and is playing hardball. It's really taking it serious. Because if you look at history, like social changes, women's rights, any other thing started with a few crazy guys, and they also were usually not on the upside of the hierarchy. They were somewhere in the woods. So every one of us is a change agent and can be the player who turns things around. And there will not be one big change. There can be millions of little micro transformations with patients, in a team, in my family, in many, many places. So yes, we will need system change. It's possible, it's not probable. It's also very important. It's an uphill struggle, but that also makes it exciting.
So, well, I just wanted wanted to refer to what Einstein said. I don't know if the English translation is actually the correct one, but in German it would sort of go like, problems cannot be solved with the tools that have created them. Yeah. And I think this is so fundamentally true. And if we let the people who navigated us into this crisis let us try and navigate out of the crisis only, then we're in trouble. Of course, we need all these people and we need their experience, but we also need new and fresh ideas. And we do need, as I said, a reboot of the system at least. I don't know whether we need a completely new system, but we definitely and most certainly need a lot of new and fresh ideas who are fundamentally different to those who have brought us into this trouble. And I do agree. I don't actually think we differ on that, Martin. I totally agree that it's good to have cells and minorities who start and to kickstart change management processes. But in the end, we almost need everybody, and the more we have on board, the better. So it doesn't require a start with everybody, but in the end, it should open up into a mainstream movement and to a very basic and fundamental understanding what is necessary to live synchronized with nature and in a real sustainability lifestyle, and not only in a pseudo sustainability with green painted walls and lentils instead of poultry.
Okay, Marco, you wanted to say something as well.
Yeah, I mean, I agree with all of that, really. I mean, if you think about our current political system, then I think in very many countries you see that politicians really haven't done their job properly. And if you understand as their job to protect sort of the welfare of the citizens in their countries, then sure enough, they should have passed stringent climate regulation, stringent health regulation, because I mean, fundamentally, everybody wants to have good health and good environmental conditions, and they utterly fail on that. And I suppose if you think why they fail on that, then you have lots of things where sort of the whole makeup of how policies are made is really not up to scratch at the moment. And I can only also echo the plea for everybody to sort of keep up the pressure and join demonstrations to make sure to show politicians that there is actually some agreement to the fact that we need climate regulation. And just if you think about public health, I think some comments in the chat were, well, maybe the planetary health diet is not stringent enough even, right? But if you think about how stringent it is for red meat, it's already a 90% reduction compared to what is eaten in high income countries. So it's a major change of what people on average eat. And from all what we know about behavioral interventions in public health, you won't get that from sort of this traditional idea that, scientists or politicians just provide information and it's up to the individual consumer to take it on board or not. From all what we know is behavioral change when it comes to diets and anything else really only works when there are multiple policies and multiple reinforcing measures put in place. And that starts with having the right dietary guidelines, having proper regulation of businesses so they can't produce and sell crap to consumers, having rules of what can be offered in canteens, and having a proper price mechanism where prices of foods reflect their environmental and health impacts. And both of those things on prices are utterly missing. So when people make a purchasing decision within the marketplace, and I guess we will always be in some kind of marketplace, then at least you can demand that they have the full information to see what impact their consumption decision actually has. So there are lots of things that can be done within the current system, but the current system really has to be shaken quite a bit, and we must not get tired of calling for those changes.
So Marco, you mentioned the canteens before. That fits to a question, which is, any chance to get planetary health diets into official nutrition recommendations?
Yeah, actually, at the moment, we're working on a big piece of research where we compare the planetary health diet and other dietary recommendations to national food-based dietary recommendations. And what we find there is, most of those have been somewhat designed that they should be broadly healthy. And we indeed find that in many cases, they would definitely be healthier than what people currently eat in the individual countries. But if you look at the environmental impacts, they're not nearly as stringent enough to get you on a 2-degree pathway if everybody would eat in that way. And I think the bodies that set up those dietary guidelines, well, they didn't have that on the radar at all, right? I think once the new set of guidelines are developed, and many high-income countries have sort of a regular process by which those are updated every couple of years. And I think we should really make sure that the next iteration includes considerations not only of health, but also sustainability.
Yeah, someone also commented about the quality of food served in US hospitals. I think this applies to all the hospitals out there, at least in Germany, I guess.
Come to Oxford, it's not better.
Yeah.
it's a total disaster, and yeah. I find this. We have talked to the Charité management, who were actually quite open to an idea of changing food and nutrition in the hospital, and also at Emmanuel Hospital. But you can't imagine how difficult it is to get things done. And once again, economy is the main driver here, and it's not health rationales that are the fundamental drivers and should be the fundamental drivers for choices of what kind of foods you serve in hospitals. And it's absolutely fascinating, shocking, horrifying to see that and this is really true from my perspective, that hospitals in Germany and probably in most other countries all around the world are probably the public places that actually serve the worst kind of food. And though they should be temples for food and nutrition, because we know from science, and we have known it for such a long time, that nutrition is such an important factor for so many health conditions. And what we do, we serve, the most awful, highly processed food, mountains of animal-based foods, refined carbohydrates, etc., trash all over Europe and in most other countries. And we need to change this. This is also a matter of authenticity when we're talking about practicing healthcare in hospitals and elsewhere. You know, we need to serve healthy food to the people, you know, come what may. And this is absurdistan, you know, to see that hospitals belong to the places that actually serve worst food. I mean, this is probably changing, and there are some nice developments that we're seeing, particularly in the US, and also starting in Germany in some hospitals. But much needs to be done, particularly there. You know, it's our responsibility as medical professionals and stakeholders in the healthcare systems, you know, to change this absurdity.
I mean, I give you an example that perhaps we can use to also look back at the diet. I know that for at least 10, 15 years, people have been trying to advocate for energy-saving hospitals. In other words, to be a bit more greener. We have now stopped to talk about energy-saving hospitals, but more about zero-emission health sector, because it is a moral question. Once we see what the crisis is we are in, that you then have to stop behavior that leads to a further destruction of the planet. So it's not enough to be a bit greener. We really need to define a road to health sectors that is zero emissions. And the same is true with diet. We need to have healthy food, and it needs to be food which is completely compatible with climate protection and biodiversity protection. And all other things are not acceptable any longer. And I think from this stance, we then talk to the Charité and others, and in the beginning they will think we are crazy, but if more and more students and employees are going there and saying we are not accepting it any longer, they will see it's also a competitive factor for them to have good staff and good patients, that this will be a mandatory thing for everyone. So it looks like crazy when I'm saying this now, but I'm sure this is the only way we go, because a bit better diet is not good enough.
Yeah, I think that question of the impact that the whole medical system has in terms of carbon emissions, was also a question raised here in the group. And I'd like to forward that question as well to Christian, who's working, you know, in the field. So you mentioned before that you also have some thoughts about how hospitals can operate on in a more sustainable way. Can you give us some examples?
Yeah, it's probably more a dream. I mean, it basically refers to what I said before. You know, we have to get out of this, you know, the treadmill, you know, of the growth paradigm. You know, because if we are in a system where only growth is actually the ultimate goal in the healthcare sector, then we're doing a lot of useless stuff. And there are so many publications out. You know, nutrition is only a very minor aspect of this all, but if you look at a lot of surgery, a lot of interventional medicine that is being done, you know, we know from so many studies and from so many previous debates, you know, that a lot of what is being done in the healthcare sector actually doesn't make much sense medically, or is actually not indicated. Yeah, and I mean, it doesn't require a lot of understanding, you know, to see that this is a major source of a waste of resource, you know, and and the patients are not even benefiting from it, but we're just using enormous amounts of medical resources all over the planet to perform probably useless interventionalism based on primary economic rationales. And I think that is very important, you know, that we also reboot, you know, this whole bundle of strange concepts in order to make use of our resources wisely, and invest more in areas that have been totally neglected, you know, like lifestyle medicine, you know, particularly in the field of nutrition, or mind-body medicine, or movement. Educate people to just live a healthier and sustainable life, not only for themselves but also for societies and for the planet. And we should invest more there and cut down on you know, primarily economically driven medicine. You know, I can just go on and repeat this over and over again, because this is at least my primary finding from, you know, the fallout of all these crises that are currently going on globally when it comes to my profession. You know, that we need to think over, you know, what is really necessary for our patients, for us, and for the planet, and not only, you know, for you know, for the shareholders of the companies we work for, and for business, and probably for our own bank accounts or whatever. You know, it's yeah, it's a big task for us, but we have to tackle it anyway.
I think, Christian, it's very important. There is a window of opportunity through the Corona crisis, because there's an understanding that we need to reboot public health. We need to revisit all the tendency going into a more economic model. I think there's a lot of understanding now that if you're going more in an economic model, you will buy more risk. And you see it in the States, where you have much more economic models than we have, with a health care sector that is delivering much worse results now for the broad public. So I think there's more understanding that we need to go back from the direction of economics. So I think we will have many, many discussions within the health sector and in the society in the years to come around what kind of health sector do we want to have. And I think the understanding is there that a fully economized model is not doing what we need.
Totally agree.
There are lots of applauding hands and hearts popping up in the chat room right now to all of you guys. So I'm just sending the applause to you verbally now. And there's also one interesting question that probably is interesting for everybody listening and watching right now. Like, imagine you were a medical student aiming to become a sustainably working doctor. Like, what would your recommendations be? Marco, do you want to start first?
I mean, that was my question when I was a medical student, because in my clinical years, I saw that something was wrong. And in the beginning, I thought, I am wrong. Probably it's me. The others are doing fine. I'm the wrong guy here on the block. And then after some time, I found out, no, it's not me. Actually, there's something fundamentally missing within the health sector, which is, number one, an understanding of how we, as human beings, kind of function, kind of that we are basically relational beings. So it's very much about the art of communication and treating each other and understanding each other, not just doctor patients, but also the teams. And then also to understand how do you shift health system structures. And in the way, the realization that I wanted to have a different medicine brought me on my journey. And I just encourage you to follow your heart and to follow your journey, and you find your ways. And I recommend that you join in our Planetary Health lecture series, because you will get lots of inspiration from really great speakers. But follow your heart. I mean, just say different things are possible and you will find your way. I have found mine.
Okay,
I mean, if I could just add to that. So I'm not a medical doctor, right? But anytime that I was in contact, at a doctor's office or so, and especially after I had changed my diet based on research and became more plant-based, I think the very minimal thing that I would have hoped from doctors is to not stand in the way, right? Back in the days, there was still all this discussion of, oh, if you go plant-based, you know, you're malnourished, you will die, and all those things, right? And that obviously comes because lots of medical doctors don't get much education on non-communicable diseases, prevention, and all of those things, right? So I think if you're studying medicine now, really demand a bit more stuff on really the dietary impacts of both the health impacts, but also the environmental impacts of food choices, and not just sort of nutritional aspects, whether you get enough, I don't know, vitamin whatever, but also what are really the well-known relationships between food groups and chronic disease risk and greenhouse gas emissions, for example. So I think that would be one of the most beneficial things you can demand as a student.
It's also a nice exercise that I have done recently, you know, to ask yourself the question, you know, how do you want to be remembered? Once you're gone, just a theoretical experiment that you can do. How do you want to be remembered as an individual professional, or as a community of professionals, as a medical doctor or a nurse or a dietitian or whatever you may work in? And that's an interesting experiment to see, what kind of things arise in your mind, and what kind of goals, aims, and visions arise out of this question. And I can just really encourage you to get engaged, to go out and find the community you want to be part of, and be active and join all these fantastic organizations. For example, like Klug or PAN, I really want to encourage all the medical students and all the medical professionals, directly related to nutrition, to get engaged in PAN, who is hosting this session today also, and be part of societal change management. It's always better to be part of an active and effective team than by just sitting on your couch and being sad about all the developments and silently envisioning, what could be done, and instead, join what's already out there, be part of it, and get things done together with all those people and this growing crowd of colleagues and wonderful people out there who want to do similar things, like you might want to do. Yeah, be active. It's the only way to get things done.
I think this is a very good point, to be active, to interact, to build networks, as you're doing already. Can you, Christian, can you also give practitioners among the viewers here some advice on how to, let's say, encourage the patients to change their lifestyle to the better? Do you have any strategies how to win them for this idea to, live a more sustainable, more healthy lifestyle?
Yeah, it's a big question, probably a bit too difficult to answer in a Q&A session looking at the time frame. But also there, I can just recommend, inform yourself at first. If you are well informed, and if you are part of such organizations like Klug or PAN or ProVeg, or just a private circle of colleagues who teach and to inform each other, only then you can be a good advisor for your patients. So this is certainly the first step, and the rest is practice and empathy, and most of the people having undergone a university training in a medical school know how to get messages across. We just have to send and get new messages across, and this is actually not very difficult. Yeah. You just need to know what you want to teach your students or your patients or your friends, and how this can be done effectively, without dogmatism, without extremism, without a know-it-all attitude, that really is appalling for a lot of people. And you have to develop strategies to win over your patients, to take them by their hands, at least when Corona is over. We can't do this right now, but when it's over, we can take them by their hands and do this journey together, instead of just giving them homework and letting them alone, with what we want them to do. So this is certainly a process, and it requires love and affection and care, but this is already there with most of the colleagues, who are joining, I'm sure. And it doesn't require special, prerequisites other than being well informed about healthy nutrition or whatever you want to get across.
And here is a little tip by one of the viewers who had just used a nice image that you might want to use depending on the patient that you have in front of you. Lisa Marie Silcher said, I like the picture of a car, only the right fuel let us work properly and your psyche is part of your body. So it's just like a nice idea in between. So to slowly come to an end of this discussion, I can tell here by the comments here, lots of people, by the way, are applauding to you for mentioning the, well, profit maximization that is also part of our health system, obviously. So that whole political, economical aspect is, of course, another topic for another discussion. I'm afraid we won't be able to solve that question tonight, but maybe each of you wants to give us in your opinion, one effective measure, or like maybe the most effective measure that everybody of us can take to contribute to climate health. Marco, do you want to start?
Sure. I mean, I guess I mentioned it already. I think the most effective way is really to, at least when we talk about the intersection of health and climate change, to talk about dietary change and essentially try to be as plant-based as possible without being ideological, right? So I think if everybody keeps that in mind and doesn't get too much into moralistic arguments, I think we can have a joint discussion where we see where people can go to, really.
Okay, Martin?
Yeah, I mean, I've said it before. I think the main point is to get active, to be a change agent. And I want to introduce one concept, the concept of social tipping elements. Most of you will know the tipping points that lead to disastrous developments when certain natural dynamics, nonlinear, kind of tip into a field where you cannot get it back. Now we have this negative, but also in the social field, you have positive pandemics that spread throughout the world. And we can all be part of potentially triggering a positive pandemic. In the beginning, it looks very small, but it is possible also to have nonlinear dynamics, like the selling of the iPhone was one of them, but there are many others which were after them, and people are infected by it. They cannot go back to imagine how it was before. So I think it's, I'm very clear that the social tipping element, one can be the health sector. So you can be participating in making this a nonlinear positive change for the whole planet. And that's my vision, and I invite everyone to join in and be an author of this movement.
Okay, Christian, your last words of this panel.
Reduce, embrace, love, full stop.
Okay. So I'm transferring the applause by the viewers to you guys again. That was very beautiful. Thank you very much for this lively discussion. Thank you very much for following. I imagine that all of us, we've spent enough time in front of the screen for the past weeks already. And now doing this on free will on a Sunday night. You know, this is already the first step on the way to becoming more active. And now I think Niklas is going to tell us a bit about VegMed again, and he's going to wrap it up nicely as he has done before. And I thank you very much for following the debate tonight. Thank you.
Thank you.
Hi, everyone again. Thank you very much, Marco, Martin, Christian, and Dörthe for that very, very lively and inspiring panel discussion. Thanks a lot. I especially liked all the parts about all the questions that were there and the respective answers on how to get engaged, how to get active. And I would like to by summing up the last 3 days very, very quickly. It will be 2 minutes. I would like to give you some more reason to get active, and then share the respective websites and network information on the different organizations with you. So we did, during the last 3 days, we did actually talk about most of the top 5 global health threats defined by the World Health Organization, as the 4 of them you'll see here in blue are interconnected with food and food systems. So we touched on chronic disease with Dr. Walter Willett, and we do know from the Global Burden of Disease study that poor diet causes more deaths than any other risk factor. And this is without malnutrition, which you see here on in the list as well, on number 8, I think. So the poor in poor diet, as we know, is the fact that we do consume and do eat not enough whole plant foods. So you do need a few other things, of course, to have an optimal diet, but that is kind of the main part of it, and most of the people aren't following it. And it is the common denominator with the other global health threats I just showed you, because we know that our food system, especially intensified agriculture and livestock production, is as well a key part in the emergence of zoonotic diseases and respective pandemics. And the same goes for antimicrobial resistances, where most antibiotics in this world are consumed by animals and not humans. And today we just had this great discussion about the impact of food production, food systems, mainly animal agriculture, on global greenhouse gas emissions. And the numbers tell that we do need a lot to do to reduce, at least, or prevent the climate crisis, but we cannot do so without reducing animal foods and transforming our food systems. So we got all the good reasons to make nutrition a key part of healthcare systems. We got all the key reasons to as health professionals, support this transformation of food systems. And it would be great if we and all of you could carry this energy to VegMed 2021. Very warm invitation again to be part of this conference. And of course, we don't want to wait to get active and to become the change agents we talked about. So there are, of course, the social media channels of VegMed conference itself, of the Physicians Association for Nutrition, ProVeg International, Emmanuel Hospital in Berlin, and then there is the chance, of course, to become a member of Klug as well at klimawandel-gesundheit.de, and to join the Planetary Health Academy as well, which is conducted by Klug. Yes, one last thing, because it was mentioned, so there are a lot of great projects. One project was mentioned in the interview, in the panel discussion, sorry. It's about whole food, plant-based food in hospitals. And if you have a look at the PAN or ProVeg website, you will find a manual for hospitals to change the food in hospitals. So that might be something of interest for you as well. So now, thank you very much for participating in today's event. Thank you very much for having participated in the whole series. As Dörthe said, the webinars were recorded and will be published next week on VegMed social media. So make sure you got these, and tell your friends, family, and colleagues to watch, hopefully. Thanks to everyone who participated today. Thanks to the great panelists and our host, Dörthe. I wish you a very good evening and a great start with next week. Goodbye.